Hey, Jovi.
Hey, Dr. Phillip, how are you?
I'm doing well.
Yeah,
Yeah, I'm in vacation mode.
you're on vacation mode. So am
Yeah.
I. I like your background,
Thank you. Thank you. Yeah, gives me a good idea about vacation.
right?
Yeah,
Well,
exactly.
you're close though on your vacation.
What do you mean by that?
Aren't you and Gay going to Cancun in November? You had mentioned or
Oh,
October,
yes. Yes, yes, yes.
right? So it's
Yeah,
almost close.
yeah, yeah. Okay, there you go.
And I think one of my aunts is jumping on, my aunt and my uncle. So
Okay,
Tina's mom, she
okay.
ordered a couple of
Martha.
things.
Okay,
So I know she's jumping on as well. Well, she said that she was gonna jump on.
okay. I don't want to take too much time from your exercise group, right? Because tonight is supposed to be exercise.
Mhm.
Okay. So you cut me off when you want to.
Let me just text a few more people. So Jim, give Dr. Phillip your good news.
Which one was that?
Your coffee and creamer.
Oh, yes, I did get my coffee and creamer and I look forward to them every day.
That's awesome.
Yes. And I was able to give blood too. I don't know if I ever mentioned that.
Mm-mm.
No,
They
that's
finally-
very cool.
They finally accepted me.
Very cool. Very cool. I just read a study that if you drink between a half to 3 cups of coffee a day, that reduces your risk for cardiovascular disease and improves the function of your heart.
Oh wow. How many?
Anywhere from a half a cup to 3 cups.
Oh, okay. Nice.
Yeah. Over
And you
3
drink-
doesn't help, and less than a half a cup doesn't help.
Okay.
Well, I'd like to tell you guys that I just had a cup of coffee with the creamer and I was not able to wake up. I was having a very, very slow day and I'm like just dragging along all day long. So I said, I'm going to drink some coffee. I don't know if I'm going to be able to go to sleep tonight, but I'll drink the coffee because I got to do it. So I'm already pepped up, ready to go. Okay.
Great.
Good deal. Good deal.
I do have a question for you, Dr. Phillip.
Go ahead.
Let me go into my calendar. I know my cousin wanted me to ask you in reference to epilepsy. Does any of the CBD or CBDA work for epilepsy? Because one of her daughters has epilepsy.
So supposedly, I should say supposedly, the first FDA approved CBD drug was for a specific type of epileptic seizure in a child. So anecdotally, I've heard that it helps. I've had patients that have used it with their kids and it seemed to help. But it's something that should be done with the guidance of usually it's a neurologist that is prescribing the medicines. This way, there aren't any inadvertent effects. And what I mean by that is it could accelerate the prescription medications. So that's why it's usually a combination of adding the CBDA and then slowly decreasing the medicines for epilepsy until you can find that sweet spot. In some people, they can get completely off their medications.
Yeah, because she has a doctor. My cousin was telling me that was prescribing her something for the epilepsy because she'll space out and then she won't know where she's at. So it's not too, like, it's not really bad, she said. but that she does space on and she doesn't remember where she's at. So that's what happens to her. They're actually graduating from college right now.
Okay.
Because she was also asking about the bliss, if that would help for anxiety as well.
Anxiety, yeah.
Mhm.
Yeah. In simple terms, that's called an absence or a petit mal seizure, where you literally kind of zone out or forget where you're at or just lose connection with the world.
Mhm. Okay.
Pretty scary stuff.
Mhm.
It is, because if you're driving a vehicle, that's not a good idea,
Yeah.
or operating some type of motorized equipment or machinery, it's not a good idea.
Mhm.
The upside is that you don't go through what are called the grand mal
Mhm.
type of seizure activity where you're shaking and um, yeah, it's not a pleasant or good experience.
I think my aunt she doesn't know how to get on.
Okay,
So my aunt is my mom's sister.
okay,
She married my cousin, so my dad is his uncle. So that's how we're related by both families.
okay, okay.
So she wanted to jump on. I was like, okay, jump on.
Okay.
Doctor, how about for lupus? Would that CBD A would or G would help for the lupus?
So lupus is predominantly an autoimmune disease, but it's an autoimmune disease that affects connective tissue and sometimes joints. So the full spectrum will probably be better for the autoimmune issues. However, if there's any connective tissue issues, musculoskeletal issues, pain, inflammation, joints, then the A might be better. So it might be a combination of both.
Okay, because issues with kidneys. So would that still be okay?
As long as your kidney function is okay, it should be. I've not seen anything where CBD affects kidney function. But as long as she has good kidney function or good urine output or good what's called creatinine clearance, then she should be okay. The other thing that'll be helpful is the CellUV, because glutathione is needed by every cell, especially in autoimmune issues.
Okay. And I really like cellular G. That really has been working out for me. So
Yeah, it's really helped me in my COVID recovery to kind of give me that little more energy and stamina that I need. So I'm still doing the 3 scoops a day.
okay. How much do you think I should recommend for this lady? What do you
How old is she?
77.
So she should probably work up to 3, and it's probably going to stay at 3, just because of age, and then also because of the autoimmune issue.
Okay. 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 Thank you, Doctor.
You're welcome.
I spoke with Bertha, Dr. Phillip, also yesterday.
Okay.
Her ulcer did open up, so they wrapped it up for her. But she said that she believes that the CellUV was the one that's been helping her out a lot.
Yeah. Makes sense.
Because she says that it would have been worse.
Mhm.
So she's taking that 3 times a day, she said. That
Yeah.
she's taking that one 3 times a day.
Yeah. You can split it up, take it all at once. If you're used to doing things multiple times a day, it's probably better to split it up. but I haven't seen anything really either way, whether you take it all at once or you split it up.
What about the CBDA for her? Should she split that up morning and evening for the pain? Because she's in a lot of pain, Dr. Phillip.
She can increase the CBDA, but she should also stick with the full spectrum because of what sickle cell does to the body.
She's,
So probably-
she's just doing the CBDA. That's all
Yeah.
she purchased.
Oh, she's just doing CBDA. Is that what you're saying?
Mhm.
I see.
Correct.
Okay. Still increase it.
Okay.
And then if she's not seeing an effect, she can try the full spectrum. Especially at this point where she's trying to do a wound ulcer healing aspect.
Yeah, I'll tell her. I don't know if she's able to jump on or not. I know I was messaging a few people earlier.
Okay.
Just going back with the same thing that I was asking doctor on the lady with the lupus.
Mhm.
She's the one that broke her hand and all her arm is black and blue.
Mhm.
The CBDA also, and she's having a lot of pain in the arm, I guess,
Mhm.
the whole body. But would the CBDA help with the pain also?
Yeah, will. And also, she can also try the cream too.
Okay. I mean, the poor woman can't sleep even at night. So
Yeah.
we're trying to help her, but I don't know what else to give them. And they were saying to give her Benadryl. They gave her 2 Benadryls. She doesn't
Mhm.
even fall asleep with that. That would knock me down for 2 weeks. So,
Yeah.
but,
I just spoke with my cousin yesterday who was wakeboarding or body surfing or whatever that's called. And somehow he got tossed in a wave and slammed his chest to the sand and he bruised a couple ribs. So he increased the A at night and then used a cream and that's helping out with his chest contusions. So I don't see any reason why it shouldn't help your friend.
okay. I can take her to some of the CBDA cream for maybe just the morning and then see if she likes it and then go ahead and let her use the one for the night.
Yeah. Yeah.
She's got all kinds of problems, so it won't be anything. I mean, I don't. She's taking medication. Would that kind of go against her medication?
Depends on what medication it is.
She's diabetic. She's taking blood thinners that I know for a fact. She's taking the Tylenol for the pain. But there's other medications that I just don't know what they are.
Yeah, so depending on what type of blood thinner it is, that may be an issue. Only because the blood thinner may need to be modified by her physician. So she should probably talk to her physician that's prescribing medications before she starts the oil. As far as the cream, there shouldn't be that much absorbed in the skin if she's only using 1 or 2 packets a day to affect the medications. But to be on the safe side, she should probably talk to her physician.
Okay. Thank you, doctor.
Sure.
So again, I'm sorry. So that Cellular B would be okay for her then?
Yeah.
Okay.
Yeah.
Just kind of making pluses on what I want to give her then.
Yeah. Yeah. The only potential contraindication would be if for some reason her kidney function is so poor that she can't handle the little amount of amino acids or protein building blocks that are in it. But I can't imagine that her kidney function would be that poor since she's a diabetic and she's on diabetic medications. Because most diabetic medications, other than insulin, require relatively good kidney function.
Okay. It's not on insulin though, so that's, to me, that's a plus already. And she's kind of very well controlled. And again, there's another plus, but you know,
Mhm.
there's so many little issues that she suffers anxiety, and that again, I could say that even the celery is going to help her with that.
Mhm.
CBD, but it's going to be the CBDA for the pain. So
Yeah, she should really, just because she's on a blood thinner, she should really talk to her primary care doctor or whoever's prescribing the medications, just to be on the safe side.
okay, should I take that booklet about the, you know, the from the company, just so the doctor can see it, what it is?
Sure.
Okay.
Sure.
Thank you.
Yeah.
Why does life have to be so complicated?
Yeah.
Alice, do you have any questions for Dr. Phillip?
No, not today. I don't have any questions, but hello, everyone.
Hi, Alice.
No.
Well, I can say I've been trying to shake. So I have gotten to shake the spray. Haven't did the spray so much, but the shake I drink almost every day now. So
Good for you.
for my breakfast. So
Good for you.
it's pretty good.
There should be a chocolate flavor coming out, I think at the end of September, if I'm not mistaken. Could be October.
That should be good because I've been actually using chocolate almond milk to make it.
Okay.
And sometimes I'll put berries in there, and then sometimes I'll mix it up with a banana. It's really good. I like the taste of it. It doesn't taste bad at all. And I actually lost 3 pounds.
Wow. Congratulations.
Congratulations.
Yeah. Let's see if it stay off. Okay. Let's check back.
Slow and steady.
Exactly. Sherry, do you have any questions?
No, ma'am.
Really? I think Sherry, you're on mute. I don't know if you didn't unmute yourself.
It looked like she unmuted for a few seconds.
Great. Rita, did you have a question? You did have a question, right?
I did, but I can't remember what it was.
Okay,
Write it down for next week.
Mhm.
great.
Good deal.
I think I have one more question, Dr. Phil. Let me double check.
Go ahead.
And it was the epilepsy, because I did tell her that I remember a story that you had mentioned that it was because of epilepsy that the CBD was done. I know my aunt suffers with arthritis,
Mhm.
so she ordered the CBDA
Mhm.
and this full spectrum as well, because she's also pre-diabetic.
Okay.
So, I actually had her order the Celluv as well, and the Super 7 and the other vitamins.
The ultimate?
Ultimate, yes.
Good deal.
So she got the whole package.
Cool.
And so did Tina. So I know, oh, Christina. So they're both going to be on it as well.
Cool.
Mhm.
Yeah, be anxious to hear how they do.
Mm-hmm. Yeah, because I like the Celluv a lot. So I noticed a big difference with that, actually.
I agree.
Mhm.
So Dr. Phil, what's the difference between the Kyani for the morning and now the Super 7 vitamins?
That's going to be a Jovi question because I don't know anything about the Kyani products.
Yes, I understand that. Okay, well, I'm on the Kyani products, but
Mhm.
we're talking about the Super 7 vitamins. I'm just trying to get the best energy from that I
Yeah.
can. But now I'm going to start having all these issues with allergies, and today was an allergy day. So for me, so I can't waste the day on not feeling well and not having energy,
Understand.
which is what I had today.
Yeah. So I can tell you about the Super 7. It is 7 antioxidant fruits that help to boost your immune system by boosting antioxidants in your body. That's one thing. And the other thing, I found this out from my dentist. It uses xylitol as a sweetener, and xylitol, and also because it's chewable, you need something in order to make it kind of, I guess, palatable, if you will. So anyway, xylitol, what it does, and again, this was after discussion with my dentist, xylitol helps to neutralize the pH in your mouth. So in other words, your mouth isn't as acidic and becomes more pH neutral. And by doing that, it helps to reduce the decay and degradation of the enamel of your teeth. So he thought it was pretty interesting because I told him that I have one in the morning and then I have one at night, and I usually chew it before I go to bed. Just because that was my habit. There was no really rhyme or reason, but he was thinking that was probably a good idea because of the xylitol that helps to correct the pH in your mouth, so that this way there's less acid in your mouth when you're going to bed and potentially less risk for tooth decay. So he thought it was kind of interesting. So that's another kind of side effect or side benefit, I should say, not an effect, but a benefit of the Super 7. And then Jovi can talk about the Kyani products.
So
I
it's
know.
almost about the same, the Super 7 and the Sunrise. So they have about the same effects because they're bioavailable in your body.
Okay.
So it all depends on the person. So if you benefit from it better, I think if you want to try the Super 7, I would recommend for you to try that one too, because it has all the antioxidants as well
Okay.
that the Sunrise has.
For I know a person that had gastritis, but it's that silent gastritis that it just at night when you're sleeping, it just goes up like into your mouth. And what happens is now she has almost literally reduced her teeth in half because the enamel has worn out, and by chewing and all that, the teeth have worn out to half of its sizes.
Unfortunately, there's not much you can do to protect your teeth when you have what we term it as GERD, which is gastroesophageal reflux disease, which means that the acid literally kind of backs up. So for those individuals, usually they're on some type of medicine whether prescription or over the counter, in order to help reduce the acid. Weight reduction is key if they're overweight, because the less weight you have in your abdomen, the less that's going to be pushed up on your diaphragm, and then hence the esophagus gets kind of refluxed up from the stomach and the stomach contents. And the last thing, when it's really bad, people end up sleeping almost upright, kind of like in a recliner chair. So this way things kind of stay down. You're never supposed to have a late meal. The last meal is also always supposed to be light. And then final, there's a mnemonic called CAFA, C-A-F-A. And those are the things you're supposed to avoid. Caffeine, which we just talked about, which is kind of beneficial, but also in the caffeine family is chocolate, or specifically cocoa. The first A is for anything acidic. So that means citrus fruits, tomatoes. The F is for fried, fatty, and then spicy food somehow gets thrown in there. I guess because usually when you fry something, it's usually spicy. I'm not sure how that S got in there. And then the second A is for anything acidic, as far as aspirin or aspirin-like products. So that literally means aspirin, Advil, Motrin, ibuprofen, Aleve, those type of things.
So what are they supposed to replace that with if they can't take that?
Well, so for the pain aspect, it would be Tylenol. And then all the other foods you just eliminate or reduce dramatically.
Okay. Well, thank you. That's a big boost. So
Yeah.
even Super 7, one Cytol, not that it's going to cure, but it's going to kind of just help it out to at least keep the half of the teeth that she has.
Maybe. Yeah, maybe.
Okay.
The other thing that my dentist, and actually he supported it, and I heard this probably a decade ago now, and that is rinsing your mouth out twice a day with a combination of hydrogen peroxide, biotine, and then your favorite mouthwash for flavoring, as long as it doesn't have alcohol in it. So I usually bounce between Act or Listerine, whatever one I can find the cheapest. And then it's equal parts. So that means if you're going to make a 12-ounce container, it would be 4 ounces of hydrogen peroxide. And the hydrogen peroxide is the one that you usually get at the pharmacy. It's usually in a brown bottle. It doesn't have to be a brand name. I get mine at the dollar store for 99 cents. And then biotine, that's the only thing that is a brand name. And then the Act or the Listerine doesn't have to be the brand name. Whatever is, and it's usually right next to it on the store shelf. The store brand one is always a lot less expensive. Just make sure it doesn't have any alcohol in it.
Okay. Well, it would go well. Can't drive after that.
Yeah, so I just mix 4 ounces of equal parts of those, and then I rinse twice a day with that.
Thank you, Dr.
Mhm.
I think even the hydrogen peroxide, even for us that we don't have GERD, that works out even just to keep your own teeth.
Right. So this is just for good preventive dental health.
Yeah.
That's all. It has nothing to do with GERD. For your friend, it may help to reduce some of the erosion in the mouth. But for everyone else, it's just good preventive dental health.
Okay.
I think that's the one that I'm gonna try too, the Super 7. I wanted to try that one as well, but because of that, what you were talking about the teeth, that's always a good thing.
Yeah.
That's the only thing that Kayani doesn't have, Martha.
I noticed that. Okay, if Super 7 is better, how is it? But I did not know that Kyani and Dr. Phil were two different companies.
Mhm.
So I got
Yeah.
enough. But you know, every time we come out with one question, there's always some good information that Dr. Phil gives us, and you can always use it for yourself in any way you want to, because it's just going to help us. That's all.
Thank you.
Mhm.
I mean, preventing more cavities is better than having cavities and losing your teeth. So
Yeah. Yeah. Us adults get only one set of teeth, right? Gotta hang on to them.
well, also with diabetes, doctor, they always tell you that you may lose your teeth because periodontist disease. So do I want to do that? No, I don't, but it might happen. So I prevent it.
So there is a correlation between periodontal disease and diabetes. However, it's reverse, and that is the worse your periodontal disease, the worse your diabetes is. So people that have better periodontal gum health, their diabetes gets better. Their A1C drops. There's something else we look at. It's called the CRP, cardioreactive protein. And it looks at the risk of cardiovascular inflammation. And that goes down when you have better gum and teeth health.
Oh my gosh.
So it's kind of the reverse.
See, one question leads to another, so beautiful.
That's good.
I mean, a lot of people don't think that that's related with diabetes, and you know, you end up finding out almost at the end that you're losing your teeth because of this, and you didn't realize that that was happening. So, thank you. That is going to just help out. Thank you.
Yeah.
Doctor, I'm still having a lot of energy from this coffee. What am I going to do now?
You guys should start exercising.
We should start exercising.
Besides exercising, of course.
That's always good.
I am so warm and I'm ready to go.
Yeah, it's 7:30 out there by you guys, right?
Yes.
8:30 for Rita.
Mhm.
And like for the coffee, I know the coffee for me, I take the coffee before we do the workout and I
Mhm.
feel a difference, especially with the CBDA one.
Mhm.
I don't know if it's because of the heat or what, but I feel like I sweat a little bit more with it than the
Mhm.
regular coffee. I've noticed that, or I compared both of them. So I noticed that difference with the CBDA coffee.
Good deal. Makes
Julie,
sense.
I think also because it's warm, you start feeling the warmth in your body. So you start perspiring, because this is what's going on with me right now. I can tell that right now. And I'm like, okay, it must be that I have to go. That's why I'm saying I'm better start painting, because I got a lot of energy now.
Yeah,
That I have. So
that's good. Does anyone else have any questions for Dr. Phillips?
I think I'm good.
Good deal.
Thank you so much, Doctor. You
You're welcome.
answered questions.
You're welcome.
Yeah, thank you a lot, Dr. Phillips.
You're welcome. Welcome.
Thank you.
So next Friday?
Next Friday, Yeah.
Okay, usual time?
usual time.
Okay, sounds good.
Yes,
Y'all have a
I
great
haven't got
Labor
in
Day
my
weekend.
schedule for next week though, but yeah, still the same time.
Okay. Okay, good deal. You're not working Monday, right?
No,
Oh,
I'm off Monday.
awesome. Cool. Very cool. Good deal. Okay. Well, y'all enjoy. Have a great Labor Day weekend, and we'll talk next Friday.
Okay, you too,
Thanks,
Dr.
Steve.
Phillip.
Dr.
Thanks,
Phillip.
Dr. Phil.
Bye-bye.
So
Thank you.
much.
Bye-bye.
Goodbye, doctor. Thank you.
You're welcome.
All right. Are you guys ready for the workout?
Yes.
Yes.
You're like, "Yeah."
Sure, if we have to.
This one's not too bad. I'm like, it's not too bad.
I've heard that before.
Thank you.
I know, right?
I love the one.
Guys are bad.
Can we have those every Sunday?
Hmm?
I love the ones that we had on Sunday. Can we have those every Sunday?
Every Sunday?
Yeah.
Only if your sugar levels are high.
Then I have to.
What is your sugar level though, Martha?
142.
142? Okay. How about yourself, Rita? Are you gonna work out?
Yeah, as
You are?
much as I can.
Okay. What's
112.
your 112? Okay, perfect. Jim, you're not working out, right?
No,
Okay. How about yourself, Sarah? Well, you can't, Sarah. So you won't be able to work out. Just write down the
You need a
workouts.
little. Yes, ma'am, because mine is high. It's 319.
Yeah, no. So no, you can't work out. All right, so then we're gonna start with, it's gonna be jumping jack squats, then running in place, and then backward forward lunges. Let me just get my timer. So the jumping squats, they're gonna do jumping jack and then squat. So that's the jumping jack squats. Then the next one is running in place and keep your knees up high. And then backward and forward lunge. So it's gonna be backward. So we're gonna do 1 minute on each side. And those are the 3 workouts for right now. So then we're gonna start off with the jumping jack squats. Let me get the timer. And that's gonna be for 1 minute. And start now. And that's 30 seconds. Ten seconds. That's 5, 4, 3, 2, 1. Okay, and then we're gonna do running in place and try to land on your tippy toes. And we're gonna start in 5 seconds. 5, 4, 3, 2, 1. Next 30 seconds. Next 10 seconds. Next 5, 4, 3, 2, 1. Now we're gonna go backward and forward lunge. And you're gonna go forward with one leg and then forward backwards, okay? And we're starting in 5, 4, 3, 2, 1, okay? You can hold on to a wall with your tippy, your fingertips, or hold on to a chair. That's 30 seconds. That's 10 seconds. That's 5, 4, 3, 2, 1. Okay, and then switch legs. Can be in 5 seconds, 4, 3, 2, 1. Start. That's 30 seconds. That's 10 seconds. That's 5, 4, 3, 2, 1. Okay, we're gonna do a 30-second break. We're gonna go to the floor and you just lower down your heart rate. Let's just do a 30-second for right now. That's 5, 4, 3, 2, 1. Okay, and we're gonna go down to the floor and we're gonna do modified windshield wipers, reverse crunches, and reverse sit-ups. So let me show you the modified windshield wipers. So you're gonna go to the floor, you're gonna have your hands out like a cross, your legs 90, and then okay, and then go to the other side. And try to go down to the floor. Okay, so that's reverse or modified windshield wipers, and then your reverse crunch. You're going to have your legs halfway, and then you're going to push yourself up. So you're going to have 90, and then push your knees up to your forehead. And those are your reverse. The other ones are going to be your reverse sit-ups. And these you're gonna Try to push yourself up and then go down. You're going to arch your back so it's not vertical, it's gonna be a little slouch. You're gonna go down like 6 count. And you pick yourself back up. And you can hold on to your legs, however you push yourself up, and then go back down. Okay, so then we're going to start off with the modified windshield wipers. And we're starting off in 5 seconds, 4, 3, 2, 1. That's 30 seconds. That's 10 seconds. That's 5, 4, 3, 2, 1. And then we're gonna start with the reverse crunches. We'll be rotating our knees to your face. And we're starting in 5 seconds. 4, 3, 2, 1. That's 30 seconds. That's 10 seconds. That's 5, 4, 3, 2, 1. Now we're gonna do the reverse sit-ups. And we're starting off in 5, 4, 3, 2, 1. You go up like a Superman and then just go nice and slow with the 6 count. That's 30 seconds. That's 10 seconds. That's 5, 4, 3, 2, 1. Okay, so we're gonna start off with push-up walks. We can go on our tippy toes or our knees, tabletop Supermans, and then we're gonna take a minute break. So the push-up walks, let me show you that. You're gonna be on your hands and knees, and then you're gonna go walk, push up, walk, and then push up. If you're comfortable with your toes, you can do the same thing with your toes. Walk and then push up. And then the next one's gonna be tabletop Supermans. So then you're gonna have your right hand and your left hand or leg up. You hold it for 2 count. The same thing with the opposite leg and hand. That's your tabletop Superman. Okay, So we're gonna start that off in 5 seconds. And we're starting in 5, 4, 3, 2, 1. That's 30 seconds. That's 10 seconds. That's 5, 4, 3, 2, 1. The next ones are tabletop Supermans, and we're gonna start those off in 5 seconds. 4, 3, 2, 1. That's 30 seconds. That's 10 seconds. That's 5, 4, 3, 2, 1. Okay, and we're gonna take a 1-minute break. Get some water, cool down a little bit, and then we're gonna do all of that all over again. That's 30 seconds. It's 5, 4, 3, 2, 1. Now we're gonna start off again with the jumping jack squats. And that's gonna be for 1 minute. And we're starting in 5, 4, 3, 2, 1. That's 30 seconds. That's 5, 4, 3, 2, 1. And now we're gonna do running in place, your knees as high as you can. And that's starting in 5, 4, 3, 2, 1. And that's 30 seconds. That's 5, 4, 3, 2, 1. So the next one is going to be your modified windshield wipers.
Lunches?
No,
No?
not that, not the lunges. So it's gonna be the modified windshield wipers.
Okay,
Okay.
yeah.
And we're starting in 5, 4, 3, 2, 1. Thirty seconds. That's 10 seconds. That's 5, 4, 3, 2, 1. Next one's gonna be reverse crunches. We're starting in 5, 4, 3, 2, 1. And that's 30 seconds. That's 10 seconds. That's 5, 4, 3, 2, 1. Next one is reverse sit-ups. So try to push yourself up and then go down slowly in the 6 count. And you're starting in 5, 4, 3, 2, 1. That's 30 seconds. Ten seconds. 3, 2, 1. Okay. And then the next one is going to be push-up walk. And you go side to side. And this is gonna be working our shoulders. And we're starting in 5, 4, 3, 2, 1. 30 seconds. Ten seconds. And that's 5, 4, 3, 2, 1. From here, we're going to do the tabletop Supermans. And we're starting in 5, 4, 3, 2, 1. That's 10 seconds. That's 5, 4, 3, 2, 1. You okay, Rita?
Yeah, it's just, I'm more out of shape than I thought I was.
And then we're gonna do the burnout. So it's gonna be 30 seconds of jumping jacks and then 30 seconds of squats. That's why we didn't do the lunges.
Gotcha.
Let me get that. So we're gonna be doing 30 seconds of jumping jacks, starting in 5, 4, 3, 2, 1. And just regular jumping jacks. No,
Not happening. Not happening.
take your time. That's fine.
Boy, it takes no time at all to get back.
And that's 5, 4, 3, 2, 1. And then we're gonna do the squats, just regular squats. And that's also 30 seconds. And that's in 3, 2, 1.
Lots I can do.
10 seconds. It's 5, 4, 3, 2, 1. How did you guys feel with that workout?
Good.
Good?
Woke me up.
It woke you up? Did the coffee help out?
Now I'm gonna have to get hooked onto that coffee.
Great.
It worked. My coffee's not doing it for me anymore.
No?
So this works really well.
So is it the CBDA, the one that I left you?
Yeah.
Yeah, okay, good.
Now, I only use it for special occasions.
For special occasions.
And this was my special occasion that I didn't have energy for anything.
Well, I like it before I work out because I feel like it helps me with my joints for whatever reason, because of the CBDA. I know Dr. Phillip says that it doesn't have that much CBDA in it. But for me, I think I do my workouts a bit better with it. Like I actually exceed myself a little bit more.
Yes, it does.
Okay. Jim, did you like the creamer? How did you like it? Oh, he didn't hear me? How's your blood sugar, Martha?
Coming.
Okay, yours, Rita?
90.
90? Oh,
Mhm.
wow. Okay,
I got 119.
119? Oh, wow, that dropped a lot too. Oh, you guys did really good. That's awesome.
It was a hard workout.
Was it or no?
Yes.
Yes, yes.
Tell you, a couple weeks without exercising sent me right back to square one.
Did it? Oh, man. Yeah, I did one this morning. So I was like, oh, okay.
Oh,
So any achievements for this week for you guys?
Pardon me?
Any achievements that you guys saw?
Other than the sugar going, the insulin going down again?
It went down more?
2 more oh, no, it was 2 units last week, right?
Yeah.
Yeah, not since then, no.
Oh, okay. Oh my
Yeah.
God. I was gonna say yes.
Yeah, I wish. It wouldn't happen that fast.
No, that's still good though.
Yeah.
I told Christopher about your 2 units. I told him about your weight loss too, Jim. So he was excited about those. So I know for Jim, I'm going to be putting out your story. I want to put it out by tomorrow, no later than Saturday. Okay, just so
You're gonna
you're
be a little
aware.
busy tomorrow.
I've been a little busy. Like I've been a little busy. Yeah, I'm gonna leave here around 5 o'clock, but I'll probably be coming back home tomorrow. So instead of spending the night like I wanted to.
well, could have been the girls' night out.
Right? Just to rest. I think I'm just gonna come home and knock out.
You're probably going to stay there till the last second, though, aren't you?
Yeah.
Yeah.
Yeah. So we'll see. I know I'll be helping her out a bit.
Help her set up a room.
Mhm.
That's
Yeah.
good.
Yeah.
How long is the trip, Joby?
We Googled it. It should be like 3 hours.
Oh, okay.
No more than that, because we're gonna take the tollway.
Oh, okay.
So it might be shorter than that, but it's Labor Day weekend and I saw a lot of cops in the city today. So I was doing regular instead of speeding.
Oh,
I was like, oh man, it's Labor Day weekend, but I can't speed. Because they're watching. There was a lot of cops today.
wow.
So yeah, even here in Oak Park, driving to the city, I was like, this is too much. So they're parked and they're just waiting for for you to be speeding.
Thank you for the warning.
Right?
Uh,
Yeah, there's a lot. I might go visit you on Saturday, Martha.
Okay, let
Okay?
me know. Let me know around what time,
Okay,
okay?
that's good.
Yeah, that's fine. Joby,
Monday.
I gotta leave because I gotta go pick up my son.
Go ahead,
But,
go ahead.
Yeah, just let me know what time.
Yeah.
I'll be Saturday, but let me know. Okay.
Okay, keep you posted.
Bye, Jim. Bye, Rita. Bye, Joby. Thank you.
Bye. Well, you
Bye.
guys have a good one. Any other
Bye,
questions?
ladies.
Bye,
Bye-bye.
Sarah.
Good night, folks.
Good night. Have a good one.
Good night.
Good night.